Hello and welcome to the European Magazine interview. I'm Juliette Foster. Breast cancer is widely perceived as a women's illness, yet that assumption can have fatal consequences. Men can and do develop breast cancer. Each year in the United Kingdom, for example, around 390 men are diagnosed with the disease, compared with approximately 56,400 women. In the United States, the American Cancer Society predicts that 2,800 men will be diagnosed this year, and out of them, 510 will die. Now, while the numbers may seem small, the consequences of late diagnosis are anything but. Male breast cancer is often overlooked, under-discussed, and diagnosed too late. But awareness can save lives. Joining me to shed light on this vital issue is Professor Dorothy Makanjuola, who's Director of Women's Imaging at the Women's Hospital in King Abdulaziz Medical City in Riyadh. Professor, thank you so much for joining us. It's so good to see you. Why is it that some men are more likely to develop breast cancer than others? Are we talking about hormonal factors at play?
Thank you for having me, Juliet. You're correct. And the hormone that is responsible is estrogen. Estrogen is predominantly a female hormone. And when men have excessive estrogen in them, sometimes related to treatment, other times, like liver failure or liver diseases, you can have increased estrogen. And there's a particular genetic abnormality which causes high estrogen in men. It's called Klinefelter syndrome. Klinefelter syndrome, when they have it, they have an extra X chromosome. Like men usually have XY. They have XXY. And because of that, they have excessive estrogen and they can have cancer, typically like women.
But what about diet and lifestyle? Can they also have a bearing on the condition?
Correct. Obesity, excessive alcohol, lack of exercise can increase the estrogen level in anyone. And this is why it's also the advice we give to women, and men should also respect that.
Whenever we talk about female breast cancer, there are two particular genes that enter the conversation, BRCA1 and BRCA2. Are these genes also relevant to men?
Precisely, they are. The most important one for men is BRCA2, breast BRCA2. Now, normally we all have these genes, and when they're normal, they prevent abnormal tissues from growing and spreading. For those who have deformity of this gene, they cannot have anything to prevent the growth because tissues, bad tissues like cancer grows and then it spreads. So that's what happen. That's what happens. And unfortunately, men also have the same thing.
Is there also an increased risk factor for a man if there's a history of breast cancer in the family?
Correct. This familial cancer syndrome due to many abnormal genetic factors, most of which we don't know. Therefore, a female having breast cancer in the family and ovarian cancer, a man is also susceptible to this genetic factor and can have breast cancer. And this is why we advise whether it's a man or female, male or female with breast cancer in the family, you may be susceptible. And this is why we advise genetic counseling to ensure that you do not have BRCA2 in particular, which might dictate screening because you are susceptible like women.
I do want to look at screening and other treatments as the conversation progresses, but I'm glad you've mentioned it because I want to broaden things out by looking at diagnosis rates and, of course, outcomes. From your experience, do you feel that race, ethnicity, or even socioeconomic status actually has an impact on the diagnosis and the outcomes from those who are diagnosed?
Of course, it does. Poverty, lack of insurance is likely to delay presentation and diagnosis, and that would cause very bad outcome. We do know that it's been recorded that Asian men are less likely to have breast cancer than North America or European. So this is what we know.
But clearly, it's important information which will no doubt shape treatment. So this is part of that journey of knowing. But there is a sense of tragedy surrounding this because men are unnecessarily losing their lives because of what is a genuine unawareness of the dangers and, importantly, a lack of discussion around the issues. We're talking about them now, but these conversations are very rare.
It's a shame that right now we are celebrating the increasing number of breast cancer survivors in females. Unfortunately, we're not talking about males. Our males are dying because they are not diagnosed early, and this is wrong. And this is why we should emphasize the existence of male breast cancer, create and increase awareness in it. And before I forget, can I just mention that very often we put on a pink ribbon to indicate support breast cancer awareness to female. I think it would be useful if we make it a combined pink and blue. Because when it's pink and blue, then people will say, why are you putting on pink and blue? Right? And then we say, of course it affects men. Because you don't want to give the wrong, it's like giving the wrong information. This is exclusively female do. No, it's combined. So we should emphasize the male breast cancer in that form.
I don't think you'll have any disagreement on that at all. But how do you convince men to take this issue seriously, especially given that breast cancer is seen as a female-specific disease, and also the mortality rate for men is much lower than the numbers of deaths recorded from prostate cancer?
I think our best bet would be male breast cancer survivors. If they join in the awareness, the men will be convinced that they should take care. And if we continue talking about it, like in October now, breast cancer awareness should be males and females. We already have blue ribbons and pink ribbon to show that it's both. So those survivors will be very useful to convince them that, believe me, you should make sure that you get early treatments and get the best early diagnosis and get the best treatment.
In your experience, do you find that perhaps younger men are more receptive to the messaging around this condition than perhaps older men?
Probably, but it should be the other way around because it's the older men who are more susceptible because age is also a risk factor. And I wish, in fact, that the older men who have it, older men survivors, should be the one that we should target, who should readily come to help us in the awareness program.
Do you find that male breast cancer survivors are perhaps less reluctant to talk about it because they feel embarrassed?
They do feel embarrassed because it's not widely known. But believe me, once upon a time, mental illness was also embarrassing, and nobody talked about it. It was hush hush. You go, you know, very privately to the doctor to talk about it. But now everybody even talks about his own mental problem. If we can do that, awareness, 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 and then you will find that it's like any other cancer. They have breast cancer because they have breast tissue. Women and men have pancreatic cancer, they have colonic cancer, they have gastric cancer, they have liver, because those organs are present. And when you have the organ present, you can't have malignancy related to it, you see. So talking about it and making everybody know, it's like any other cancer.
But it must be very frustrating that if survivors are reluctant to talk about their experience because of the obvious and understandable embarrassment, then that must be concerning if they realise that something in their chest area isn't quite right. And again, that fear, the fear of being laughed at, the overall embarrassment deters them from actually seeking help before it's too late.
It, it's possible. What we need, if we have some reputable names who can come forward and talk about it, males, maybe the elderly ones who will not be embarrassed, because it's not like being embarrassed because you have a girlfriend or newlywed who doesn't want to talk about breast cancer. Why should a man have breast cancer? The elderly ones, reputable ones, they can come forward. And even the media can also do a lot to make sure that the awareness is there for them to understand that, listen, it's like any other cancer because we all have breast tissue when we are born.
What are the symptoms of male breast cancer, and are there classic signs that men need to be aware of? We know what they are for women, but what about men?
Excellent. The signs are at the nipple, in the chest wall, and in the armpit, the axilla. The nipple might present enlargement, change in color, ulceration, which may not be tender. The chest wall might show discoloration, or you might see a lump. But when you feel it, you might identify a mass behind the nipple, because behind the nipple is where the residual breast tissue is present. So very often it tends to occur in that location. And then in the armpit, that's the axilla, if you feel anything there, it's indicating that it's probably spread. So you can, by examination, you can identify it. And this is why we recommend that. I think maybe we come to that. We recommend how to examine to make sure that you identify breast cancer in a male.
Yeah, I'm glad you've said that because yes, in terms of identifying it and the type of examination to carry out, the the point that I'm getting at is that perhaps with some men it's easier to detect it than it is with other men because there are some men who perhaps have excessive breast tissue, and that perhaps makes it more difficult to find any worrying lumps.
Sometimes, in fact, many older men have some benign breast tissue, non-cancerous breast tissue, which I think some people call it male boobs. We call it gynecomastia. It's very common, but we know the features of gynecomastia, and we also know the very common form of cancer. But sometimes when they're combined, it's very difficult to identify it adequately because the swollen breast tissue, underneath it, you may not be able to feel the tiny cancer occurring in those areas. And in fact, we did a research to identify why are they coming late? Why do we have delayed diagnosis? In the study, we identified that those who have gynecomastia, which is a benign swelling, combined with the cancer, we are the ones who were delayed because the presentation wasn't typical of what we know behind the nipple. And because of that, we now, alerted, we published it, that if you have a lot of breast tissue and you're an older person, don't assume that it's all male boobs. Get examined properly and have a simple examination like the doctor will recommend it, mammography, which shows a picture of the breast area, and we can identify and find out if there's any disease underneath the so-called male boob.
Now, doctors advise women to check their breasts regularly, often before their periods, but in the case of men, how often should they check their breast tissue?
Excellent question. Can I emphasize that men checking their breast tissue is even more important than females because they don't have any screening program. So we are relying entirely on them to check themselves, to come forward. And this is why we suggest monthly. Stand in front of the mirror Take a look at the nipples, see whether there's any discoloration, any enlargement, and even discharge, which could be blood. Take a look at the chest wall, see whether there's any discoloration, any dimples. And then after that, feel the chest wall for any lump and behind the nipple for any mass, any lump. And then check your axilla, that's the armpit, to see whether there are any masses. If you have masses there, it's very unfortunate. It means that there's something here there that has extended to the axillary area. So it is more important, even compared with females, to make sure that self-examination, at least monthly, is done. And this is a must for those who have genetic abnormality like BRCA2. Extremely important.
And it's interesting that you talked about the obvious gap, the screening program, because there are screening programs for women, and indeed, as part of this treatment, women are advised to have mammograms when they reach certain age points, because again, the vulnerability increases. Is that the real issue here, that we don't have a screening program for men that runs in tandem with the facility provided for women?
You're right. I think it's because of the ratio. The proportion is very little. 1% of all breast cancer, just 1%. So it's not as common as breast cancer. And as you know, breast cancer is the commonest killer of women, you know. But in men, it goes down, a bit down. So we, as of now, do not recommend regular screening program. But those who have a risk factor, like BRCA2, should have screening program because they are susceptible to breast cancer like women. It's a selected group that should have it, but not all of them. And this is why we're relying on them, especially the older age group which are predisposed, to come forward or examine themselves and come forward whenever they feel uncomfortable with what they see.
But if the low numbers of male breast cancer invalidate the need for a major screening program, as I said, running alongside those for women, is it possible that other emerging technologies or protocols could be used to help with that detection? Because early detection saves lives.
Correct. Actually, you're right. Medical imaging is always progressive. Right now, we're thinking about AI-powered ultrasound examination. We should have a high specificity to identify cancer tissues and benign non-cancerous tissues. So that one is ongoing. We also have something called liquid biopsy or ctDNA, which we hope will be able to identify abnormal molecular size cancerous lesions in the blood. And that will be very, very early. And this is the type of research that is being done. And with men, I mean, we're thinking about the men to see what you can do early since they don't have any screening program to identify these.
Could it also be picked up in a standard blood test, for example?
Right now, we don't use blood tests for females, and we don't really do it for males because the ones we have, like C25, those ones do not really indicate breast cancer for us, so we don't use it regularly.
Okay, so it's a more refined technology that's required here that you alluded to. But
Yeah,
when you take the overview, there does appear to be a bit of a provider knowledge gap because do you sense that perhaps some general practitioners might be unaware of male breast cancer precisely because the numbers are so small, and as a result of that, it causes delays in referrals?
I believe there could be. There could be because medical knowledge is so wide. It's difficult to know everything. And especially if you haven't come across it, because it's so rare, you may not even know how to make sure when you examine that that's what you're seeing. And especially, when you have some presenting with a non-classical pattern of something behind the nipple, you can't miss it. So there could be, yeah. And this is why the awareness also comes into play to make sure that our colleagues, clinical colleagues also check appropriately to make sure that they identify cancers in male.
So in other words then, perhaps male breast cancer should be featured more prominently in medical education and GP training, so that if a man does present symptoms, the general practitioner can steer them in the right direction for treatment.
Correct. It should be like that. It should be well recognized, well taught, and be well accepted, because it's like any other cancer and nothing to be ashamed of, and to be treated promptly.
What do you think that governments and health authorities should do to build awareness? Because earlier you talked about the survivors of male breast cancer actually coming forward and sharing their experiences and stripping away the shame and embarrassment. But they can't do this alone. They need support. So what should health authorities be doing to really amplify what these men have been through and the hope at the end of the tunnel?
Same as the females. Anytime you emphasize females as the males, whether in pamphlets, whether in conferences, we are together in this fight. And so this is it. It should be all over. Hospital, government, anywhere you're doing awareness. You will notice that most times when awareness is being performed, it's only women you see. We shouldn't be like that.
Are you optimistic, hopeful that we will have the sort of conversation that you are looking for that can make the lives of health professionals such as yourself easier and at the same time save lives that are being lost unnecessarily to this disease?
I'm always optimistic. Start with pink and blue ribbons, and you'll be surprised how many people will say, "Why are you doing this? Why blue?" And that's a very good way of spreading it. And if we can get some of the survivors to help give lectures or anything to encourage the men that this thing happens to both sex, I think that will help. So I'm optimistic that it will happen. The more we talk about it, the more we're getting there.
I share your optimism too. I'm sure that there will be many conversations, especially following on from this interview. But sadly, we have run out of time. Professor Dorothy Makanjuola, thank you so much for joining us. My name's Juliette Foster, and you've been watching the European Magazine interview.